Some new research has found that feelings of loneliness are on the rise, and those feelings can have serious consequences for our health, our physical and emotional well-being.
The average size of people's networks has decreased in recent years, but there is help out there. Joining us now is Dr. Shilagh Mirgain, a health psychologist at UW Health.
Hi,
Thanks for being with
nice
us
to
today.
see
Thanks for
you.
having me.
How does loneliness affect our health?
There are many implications to loneliness. Right now is the American Heart Awareness Month, and we find that actually loneliness and social isolation is a risk factor for heart disease. Related to about 30% of people can be at risk for a heart attack or a stroke. We also find that research shows it can be associated with mortality, similar rates. So it can cause inflammation. You know, when we get too isolated, we often aren't taking care of ourselves as well.
We don't move around.
Right, we can get into some poor health habits.
Isn't it ironic, though, at a time when we're allegedly so connected by social media and all other kinds of things like that, is that contributing to people actually being lonelier?
Absolutely. You know, we can have all these Instagram followers or Facebook friends, but we find that that sometimes can really get in the way of connecting. Research shows that just in the last couple decades, there's been a decrease in the number of close confidants we have. Recent study showed the iPhone effect, that when we're just hanging out and we have just the mere presence of a smartphone, even if it's turned off, people relate feeling less connected. So there's a decreased intimacy, and once again that can really impact our health.
That's so ironic.
That is
isn't it?
interesting.
Yeah.
People just don't have as many friends as they used to. Is that part
Right,
of it?
those kind of close, you know, deep
Real
connections.
friends.
Real
Right,
friends.
where you get some of that benefit of feeling seen and being heard and understood.
I understand that you have formed a group that people can go to. What's the purpose of this?
So I'm doing a mind-body medicine group at UW Health because there are so many different skills and strategies that we can use to promote our well-being. So it's a 6-week group where we'll be working on increasing social connectedness as one of those skills.
And who are the people that would be appropriate to participate in that? Is it
Right.
people who are feeling lonely or people who have medical challenges?
You know, both would be great. Yeah, it is designed for people with medical diseases or
Issues.
conditions that want to go beyond the medical care to really figure out what can I do to better manage it day in and day out, and some of those skills that I can cultivate.
In the notes that you sent us, we have how loneliness can be a good thing. How's that?
Yeah, loneliness is a feeling, although a challenging one, and it can prompt us to take action. In particular, it can cause us to reach out to people, strangers, or maybe volunteering, or just contacting an old friend we want to connect with. Because really, across the course of our lives, friendships come and go, and there can be particular times where we're quite vulnerable to loneliness. So attending to those social connections throughout our lives, we think of loneliness as a cue. It can cause us to reach out and really work on our social relationships, so it doesn't become kind of a kind of chronic pattern of
So
loneliness.
maybe reconnect to an old friend and try and rekindle a friendship?
I think that would be a great thing for people to do this month with Heart Awareness Month, to take care of their hearts and really warm somebody else's heart.
See, there's such a mind-body connection.
there really
It's
is.
so,
There really
It
is.
is all connected. It's really fascinating.
Yeah.
Let's give folks the date of the group. It is Thursdays from March 23rd through April 27th from noon to 1 at the UW Health at the American Center. Costs mostly covered by insurance.
Yeah, most insurances will cover the cost.
So there's a phone number there, 608-890-6464 to register. We'll have that information on our website, channel3000.com. Doctor, thanks for being with us
Great
today.
to see you.
Oh, thanks
Great
for having
insight.
me. Yeah.